learned so many things. The facilitators are engaging. They are giving us group work, activities to engage our brain. You know, adult learning is kind of difficult, but for reason, the least of my concern is the fatigue. But then I have learned so many things. I have learned the sections of the MHPSS. I have learned the coordination aspect, the activities aspect, how we can lead in some cases of the activities, and how other sectors can support. So all in all, MHPSS is like a pillar on itself, but it's like going around to other sectors to ensure that the clients that need the services get what they need.
So this is a very great opportunity to work with the sector working group, Africa Mental Health Initiative, and then the Borno State Ministry of Health, funded by WHO. So it's a very great opportunity to participate in this MSP workshop. We learn a lot, and then thanks to the sector for bringing us all together. So for the MSP workshop, we learn a lot, and then we will make judicious utilization of the knowledge and the resources available in the MSP. As soon as I'm back to the office after the training, we'll make sure to discuss with the management, our manager, and then review the MSP tool, and then try to see the areas where we'll incorporate some of the MSP activities.
I should be able to say that it has come really at the right time, because as a clinical psychiatrist, I also believe that it would help a long way in impacting in my clinical practice, in the sense that it makes it very easy to develop proposals to help in integrating or incorporating mental health activities.
I'm so glad that I've been part of this training, because the minimum service package, it was a new name. When I saw it, I was like, what is it all about? But for me, it has been very impactful, because it has really opened my eyes to so many of the gaps that has been there in trying to deliver our services. And it's more like an eye-opener. It's like a pointer, and it is easy to understand. It is easy to absorb. And going through the training, it was like I'm learning something new, but it is so rich. It is so powerful, and it's a tool that if I'm able to adapt well, it's going to make the work easy, very effective, and very efficient.
And even this gathering we are having here is part of information sharing. Okay? In some cases, prioritization will be done. Like we said, people affected, people in need, but we prioritize people targeted. Even in the sector, we do that. Who are those people that need this training? We prioritize, we share.
Even though there were challenges in rolling out the package, but we experienced that the minimum service package is a handy tool. It's a one-stop shop kind of tool that enables us to easily adapt our program, our MHPSS intervention, and was proven to be much more effective in supporting especially the children and the women whom we are dealing with.
I appreciate the organizers of this training and the funders, the donors who funded this training. The training has really given me a lot of insight to be able to integrate MHPSS into every other sector. MHPSS, as we all know, is a critical component of every humanitarian or development activity or intervention. But this MSP training has really given me a lot of insight on how I can be able to integrate MHPSS into other sectors, like the war sector, the livelihood sectors, and every other sector that MHPSS before looked odd to that sector. And I am happy that going back to Yobe State, I will be able to do a step-down training for other partners.
To see how we can work together, how we can improve what is already there, and how we can use MSP to integrate our activities. And overall, yesterday when I was going throughout the trainings, I found out that almost everything that you need is already in MSP. So with MSP now, it's like when any organization wants to integrate MSP, you find it very easy because everything is there for you. You are just going to go there and get what you want, and halas.
And they really have not, been trained properly. And not that they are not professionals, right? But then when I talk about training, I mean, the community-based approach that we have been talking about. Of course, there are psychologists, there are psychiatrists and all that. But then if you're talking about community-based MHPSS, it's still very important that they understand this very critically.
We will ensure and advise to see how we can bring all the focal persons or program persons across all the thematic area we operate, such as war sector, protection sector, nutrition sector, and child protection sector, across all the sectors, so that we will also try to go through and learn more about the package, because all we need in programming, we have them on the package, which it will help us to make good impact, even have well coordination in the sector.
After being gone through the intense understanding and training on MSP, supported by WHO and the coordination unit here in the Maiduguri. Yeah, the MSP is actually a milestone that it's encouraging and also supportive in terms of program implementations for the MHPSS activities.
Our community, the community of persons with disability, are the most neglected communities so far, because we are being highly discriminated, but the MHPSS sector has shown us friendship. They have opened for us. They carry us along whenever they are doing any activities.
So thank you, the donors. Thank you, the coordination unit. Thank you, WHO. Thank you, AMHACI, and thank you, other organizations that have supported and contributed effectively to the successful, intense capacity building training.